Greetings, my name is Stan Houston, and I'm a long-time teacher, international broadcaster, a business performance coach, and I think most of all, kind of a student of the human condition. And recently I've spent a lot of time trying to learn from those doctors and healers about life and health, and particularly for those people who really don't do drugs. They are seeking to find other ways of dealing with the health issues that we have and obviously plague our lives. Can we find that perhaps there's a different way than kind of the nuclear or the surgical or the chemical ways to deal with the things life gives us? Just thinking about that. And recently I've been learning from these people, and today I learned something rather unusual from a good friend, and with your permission, I'd like to share what I learned with you. Here's some things that my good friend Dr. Craig Brew helped me to better understand about my life and health, and I found them helpful, in fact very useful, so I want to share them with you. You see, your back and body pain, your medication may be your problem. Now, when you receive a prescription from your MD, you literally expect it to help, right? Well, unfortunately, many medications that are prescribed may actually be causing your body to ache all over. Now, once you start to experience side effects from the drugs that you are taking, you may also be much more vulnerable for additional drug therapy and unnecessary further medical treatment. Now, if your medication is causing your pain, physical therapy and stretches will not help to relieve your body's aches and pains. Now, these are some of the more common drugs that can cause significant body pain. Statin drugs, cholesterol medications such as Lipitor, Crestor, and Simvastatin. Now, these drugs are a frequent cause of muscle and joint pain, and they can also cause numbness and tingling in your hands and your arms and your feet and your legs. So if you're taking statin drugs and feel stiff and achy, you need to let your MD know about it. You see, high doses of cholesterol medication can cause rhabdomyolysis, which is a rare, irreversible muscle wasting disease. Non-steroidal anti-inflammatory medications, aspirin, Advil, Aleve. Now, if you are using these medications, you could be at increased risk for stomach pain and life-threatening stomach bleeds. NSAIDs may give you temporary relief of pain, but the long-term use of these medications will decrease your body's ability to heal and repair because it damages the platelets, the cells responsible for clotting and repair. Chemotherapy drugs, doctors know that chemotherapy drugs can cause nerve damage in the form of peripheral neuropathy. You see, once a patient has nerve damage, additional medications with their own unwanted side effects are often prescribed. Opioids, morphine, hydrocodone, Vicodin, Paroset. The problem with opioids is that they turn off your body's natural pain relieving system because your body quickly becomes dependent on the drugs. A frequent roller coaster of ups and downs sensitizes the nervous system to the point that you actually feel more pain. Now, in addition, these medications can make you feel anxious, restless, and you may have difficulty sleeping. And thousands of patients, you know this, die every year from opioids because of dependency and overdose. Very sad. Other medications that may cause increased body pain, antibiotics, erythromycin and clarithromycin, prescription medications for constipation and digestive disorders, migraine and headache prescriptions often produce rebound headaches, fibromyalgia medications, proton pump inhibitors like Nexium, Prilosec, and Prevacid, erectile enhancement drugs, and some allergy medicines such as Allegra, anxiety and depression medications. It's important that you are aware of the side effects of the medications that you are taking. You see, your body is not in pain because of a deficiency of drugs. Your body is trying to tell you something, something perhaps is wrong. Now, it is possible that your body is telling you that the medication that you are taking is actually the cause of your body's pain. Now, are you experiencing chronic, recurring pain? My advice: schedule a consultation with a no-drug doctor, with an excellent chiropractor. You see, chiropractors do not prescribe medication, and they will make recommendations for your health that will not include dangerous drugs that oftentimes have more side effects than real benefits. Just something that I've begun to learn about life and business and health and good living, and that literally the master healer wants to and has equipped our body with many things that the healing can really come from within if we let it and have the faith and the good practice to do it. Certainly there are wonderful things and wonderful chemicals, and there's chemical stuff that can help us in many, many ways. But I just simply encourage you, as a student of the human condition and somebody who wants to be fully alive and live well, that perhaps we need to take a second look and think a second time about what the medication might really be doing in our life. I'm Stan Houston, wishing you all the best and blessings and helping you to do the right thing, to really do what it takes. Bye for now.